All right, I'm Dr. Eisenmann,
And I'm Joe Mooney. I'm the Executive Director of the Coast to Coast Foundation.
and I am very happy he's here, just to let you guys know. He was not expecting this. I literally opened the door and surprised him with a microphone. But we are going to talk today about something very important, which is veteran brain health. And one of the reasons as to why you're super involved with this organization and why we work together to begin with is because we believe that veteran brain health is very important, and how it's treated clinically needs to be different on how traditional non-veteran patients get treated.
We deal with a lot better with a lot more abrupt speaking, right? So I think my own opinion, when I've dealt with civilian or outside agencies for help with brain or any doctors, honestly, there's a different way that they speak to you. It's not on the level of, this is the big boy club. We're going to give you the information raw, and you'll be able to process that. And I think veterans and operators in general in the soft community as well, obviously process information at a very high rate. And
Yes.
enjoy just the directness that we get here. And we love coming here because this is like a team room.
Yes.
So we come here, we get treated like operators, which is great because they get to feel back like they're in the tribe again. They're back in the community, as well as they're being healed. And the way that especially here, the way that those treatments are diagnosed as well as given to the patient is straight, no chaser.
Yep.
And that's what they respond to.
Yeah, and you just said something incredibly important, which is community and being part of a tribe. And so when you're going to do traumatic brain injury treatment, as we know, not always the trauma is in traumatic brain injury, but for you guys, that's actually a part of it. And so when you get to come to a clinic that does give it straight no chaser at the same time as being able to do it with battle buddies, with people that have been there, done that, know and understand, healing happens at a completely different level. And so another thing you pointed out is that you guys think like operators, you guys think like veterans, you guys think differently than the regular population, which is a strength. It's something that's good. But when we compare to the non-veteran population, it's not to say that someone is more superior or inferior. It's just to say that there are differences on how we process neurological information. And so another layer to that I'm going to add is the level of injuries. So most traditional non-veteran patients, as a provider, I can speak to this. They tend to come in with a concussion, and there may be some level of other injury, but you guys may come in with, spinal cord fusion, like spinal cord issues, spine fusions. You guys may come in with, total bilateral knee replacements, gunshot wounds. And so there's a whole other layer and level of being able to understand on how to work with these patients that isn't always normal to every concussion type of clinic. And so I think that you kind of hit it in the nail. And so if there's a veteran watching right now that needs to, is really struggling with TBI, and they're like, I don't even know where to begin. I've already been to these doctors and I don't feel like it even works. What would you say to that person?
Get a hold of Defenders of Freedom, or if you're a soft operator, get a hold of the Coast to Coast, and we'll guide you here. I mean, this is where we send everybody. This is a family environment. It's a team environment. We respond better in those environments. One of the big things that I think most psychologists will tell you as well is that the last step before, unfortunately, these people commit suicide is the loss of their community or loss of relationships. And that's kind of the last step before the ultimate decision is made. When you leave the military or you leave a team, you lose some of those relationships or the last relationships that you have, which I think put a lot of veterans, especially with multiple different types of injuries as well as multiple TBIs, can put them in a very dangerous position if they're left to their own devices, or when they go seek treatment elsewhere outside of somewhere like this and they get, I won't say like joked around, or they don't really get the straight treatment that they need or even spoken to in a straight way like that, And then, unfortunately, we end up losing veterans and operators. So this whole environment here brings the whole team and tribe feel back. There's numerous operators that show up here all the time. I just did it, and now I'm doing an interview. But your community, you see guys in here that you've not seen in 20 years, 10 years. So, I mean, it's a really great environment that I obviously promote because we send our people here.
Healthcare's back in your hands.
Yes.
You get to actually understand your brain injury. You understand your other injuries, your blood work, and you get to be in charge of your healthcare decisions again.